You most likely have pain in your neck or your back if you served any time in the military, especially in combat arms, and if you've been rated for a back or spine injury of any sort, you're probably surprised that it was really low. And this isn't actually that surprising when you look at the VA schedule ratings and criteria, so today we're going to break down everything with all spinal injuries, disabilities, ratings, what to look for, how it works, why it's outdated with the VA, and what you can do about it moving forward. How does the VA actually rate spine disabilities? Well, there's actually 3 criteria that they're going to look for and actually determine which one you fit under. The first one is going to be range of motion, which is actually the most common one that everybody's talked about on YouTube, in person, somebody you probably know. The second one is going to be incapacitating episodes, which still applies to some people, but actually a lot less than you would think. And the third one, which doesn't apply as frequently, but we'll talk about it today anyways, is going to be miscellaneous. I know. Very straightforward. Okay, so let's knock out the one that is least common first, which is going to be incapacitating episodes. To be rated for incapacitating episodes, you must be prescribed and have a diagnosis for bed rest from a doctor going into your C&P exam. This is clearly stated and documented in your medical records and is something that you use as a piece of evidence before you go to your C&P exam and do anything else. So the rating for incapacitating episodes start with 10%, which is 1 to 2 weeks of bed rest that you've had within the last 12 months. This also jumps up to 20%, which is 2 to 4 weeks of bed rest in the last 12 months. Going to 40%, you're looking at 4 to 6 weeks of bed rest, and getting a 60% rating is 6+ weeks of bed rest prescribed by a doctor in the last 12 months. It's also a good thing to note, if you're actually rated under this criteria instead of range of motion, you cannot claim a secondary condition through nerve pain or sciatica going down your legs or arms, so just keep that in mind. Okay, so we're going to jump into the next one, which is going to be other or miscellaneous ratings for the spine, and we'll get into what this means. So if you meet the spinal criteria in multiple categories, the VA will automatically award you the one that makes the most sense, that is the highest rating. For example, if you're at 40% for range of motion, if you're at 20% for incapacitating episodes, it will actually just pick the 40% as its total rating, and you'll be rated under range of motion and not for incapacitating episodes. So keep in mind, this is calculated in the background. You don't have control over this part. You just have to look and see which part of your ratings that you might be able to find in your C file to really determine what they rated you under, but they're going to always pick the highest one. So let's jump into the last category, which is going to be the range of motion test. And if most of you don't know what that is, or if you've been to C&P exam, this should look familiar. This is a goniometer, and this is what the VA should be using on your back or your neck to test your range of motion. Now, to be clear, they do not do this at every C&P exam. However, I find it hard to believe that somebody's going to eyeball and look exactly at how you bend forward or even bend to the side with your back and say that's exactly this degree. So it's something that you need to think about and note to yourself if they use one or not. You might want to bring this up if you have to make a higher level review or a supplemental review claim in some capacity. Just take note of this. So I'm going to leave the scheduled ratings below so you can actually read through everything that they look for with every part of the range of motion test, but we're going to go through the very basics today. With a 0% rating, you actually can bend over and have flexion at 90 degrees. To get a 10% rating, your forward flexion is between 60 and 89 degrees. For 20 degrees, your forward flexion is between 30 and 59 degrees. And for 40% rating, your forward flexion is between 0 and 29 degrees. And to be quite honest, if you're at 40% rating, it's going to be quite obvious if you're at 40% or higher. So jumping into neck ratings, at 0% rating, your forward flexion is 45 degrees. A 10% rating is between 31 and 45 degrees. A 20% rating is between 15 and 30 degrees. A 30% rating is less than 15 degrees. And a 40% rating is going to be completely frozen neck. You cannot move it. Now, these ratings are not just forward flexion only. They will add up where you turn, how much you can turn to get a total for your flexion, but typically the test that they'll see is how far can you bend forward on both of these. Okay, so this is a little controversial. This comes from a personal story. What do you do in the exam if the examiner doesn't believe that you are having pain when you're bending forward, which you should stop at the first sign of pain? What should you do about it from this point? If the examiner is accusing you of exaggerating, if they're not using anything to measure, or if they actually physically put their hands on you, you should definitely report this right after your C&P exam. You should immediately file a VA Form 4138, which is a personal statement, and send that through Quick Submit to the VA, give the VA a call, and even give the company that did the C&P exam a call, just so it's documented that you are actually acknowledging that this happened because you think you were treated unfairly, which you probably were, and this has actually happened to people before, and you want to make sure that goes on record before your rating comes back. So I'm adding this as part of the back criteria video because this actually did happen to me. I was rated at 20% prior, about 6 months before. I went back because I filed a claim for my sciatic nerve pain in both legs. It was getting pretty bad. I actually currently had a bulge disc with an MRI that I was also bringing with me, but they rechecked my back. This C&P examiner physically pushed my back when I bent forward, and then my rating ended up being lowered. Probably because I didn't write a personal statement at the time. I did not know that I should have done this. And quite frankly, I thought it was very unprofessional. I didn't know what to do. I was a little bit all over the place from the experience, and I just went home and thought, okay, I don't know what that was about. That was really strange, and I hope that doesn't happen again. So always be professional. Always make sure you're telling somebody when the pain happens and when to stop, and don't do anything else differently. And try the best as you can to have a good attitude, because this person is also going to be the one that writes everything that the VA will look at. So even if they're being unprofessional at the time, get that personal statement ready. Now, lastly, let's jump into secondary conditions, which is probably really important for a lot of you if you are having other related nerve pain with your back diagnosis. The most common secondary condition that I've seen, including myself personally, when it comes to a lower back rating is sciatic nerve pain or radiculopathy. Now, this can be in one leg or this can be in both. For me personally, it started in one leg the same time I was having back pain, and then a few years later, I was having it in both because I think I was overcompensating. So I actually have a bilateral factor which adds up both parts of my legs. It gives me a little bit extra percentage because I claimed both because of my lower back pain. For me personally, I have a 20% rating sciatica for both legs because even as I sit here in this chair, which you've seen in a couple videos, I start to get uncomfortable, I start to move, my legs will fall asleep if I sit too long. I have to get up very frequently. So I'd say that's a very common thing to be able to claim because it really does happen frequently to a lot of people. So keep that in mind as a good secondary condition that you don't want to forget. So another common secondary that's very similar is having nerve pain in your arms or down to your hands or your fingertips, which can be between a 10 and a 20% rating on each one, which also has a bilateral factor. Along with that, you can also claim as a secondary condition migraines because your stiffness in your neck might cause tension headaches either from the back, maybe from the side, and that is a common one that you can claim because tension headaches coming from a lot of stress and a lot of tightness in your neck is going to be very common for a lot of people, especially if you were wearing your helmet a lot, wearing nods a lot, had an actual injury in-service event. It's very common. And I think lastly, one of the biggest conditions to claim as secondary is going to be mental health. If you are having chronic pain from your back or from other areas of your body, claiming mental health is a good secondary because it can change your life. At one point, for me personally, I could not physically walk for weeks. I couldn't work out, obviously because I can't walk. I couldn't get to my job. It was so destructive for me mentally to be that injured. It took a 6-month recovery, and it was a life-changing part of my life. It was life-changing to not be able to do anything, and I did not realize how limiting that was going to be, was really going to affect my mental health. So my final thoughts with this is that the VA does not really measure this correctly. The VA process has to be rigid, and it favors objective findings rather than subjective pain levels. And so from my experience and from what I've read, it's a very outdated way to look at this. I brought an MRI to an appointment that showed a bulge disc that had happened multiple times. They still gave me only a 10% rating, from 20% down to 10 because somebody did push my back. They thought I might have been exaggerating. And that pain I still suffer with every day, every single day. Not all of my symptoms that I do have are an everyday symptom within my rating criteria personally, but my back is one of them. I'm rated low for my back, and it has probably caused me the most up and down pain throughout my life since getting out of the military. So I think that this is outdated, but if you want to make sure that you are on top of it, you have to make sure to have a diagnosis, make sure to go to the doctor, and actually journal and document the symptoms that you have to bring them, and understand how the range of motion test will work. You are most likely going to have a range of motion test right in front of the C&P examiner. Understand when your pain level starts immediately. Do not push the limits. You're not trying to be a hero there. You're being very honest and very truthful. That's the biggest thing that I can say to people is don't exaggerate it, but also take care of why you're there. Take care of yourself to get the proper rating that you deserve. If you found this video helpful, please subscribe to my channel. I have a new video out every week, and we'll see you guys next time.